Let's talk about the different roles in a code blue. This may look different depending on which hospital you work for, but the general idea is pretty much the same. I'm just going to throw this out there. If you ever feel like you're going to be alone during a code, that couldn't be further from the truth. There tends to be too many people in a code versus like not enough people. And so let's talk about some of the different roles and some common like code etiquette. Really liked how these code roles were summarized here. So the first person is going to be a team leader. This is the person that's running the code. This needs to be someone who's ACLS certified. This tends to be a nurse that has good experience until a provider arrives. And once the provider gets there, usually they'll take over running the code. Next, there needs to be someone who is recording. Recorder person is usually the one who keeps track of like when the next epi is due, when a pulse check is due, when they need to swap compressors, and they should be using a universal clock and not using like just the wall and then looking at their watch, then looking at their phone, then looking at the wall clock. Use only one source of time during the code and when you're recording. We also need to have compressors. Now, obviously only one person is doing compressions at one time, but there needs to be a backup person usually standing behind them to relieve that person whenever there's a pulse check or whenever the compressor is tired. Usually kind of just like form a line of only one or two people behind the person compressing, so that way we don't get too many people in the room. Compressors can always wait outside of the room, and then your backup compressor can wait in the room. So we need to have one or two respiratory people. Respiratory people are going to be responsible for airway management, bagging the patient. If they end up intubating the patient, they'll assist with that as well. So you need to have a medication nurse. This is the person that's going to actually be giving the medications. It says vascular access, so maybe they're starting a line or an IO or something, but you need a designated person that is just doing meds. Next, we need a code cart person. This is going to be the person that's drawing up your epi, who's going to be running the defibrillator, who's going to be grabbing things out of the code cart that, the med nurse may need. If we add all of these people up, this is about 8 people in total, and that's if there's 2 compressors in the room and 2 respiratory therapists in the room. Any more than that, it tends to get clustered and communication can get kind of disarray. And so I always, if there's too many people in the room, it's okay to ask like, hey, do you mind stepping outside the room and grabbing supplies or waiting to see if we need anything? It's also a good idea to call the chaplain if you have one, or social work, or someone who can be there for the family if the family's present, or call the family if they need to come in. All right, those are the rules in the code. Let me know if you have any questions.